Hey everyone, and welcome. If you're getting ready for the NCLEX, you know that feeling in your stomach when you see those prioritization questions. Well, today we are going to crack the code on them. By the time we're done here, you'll have the exact mental tools you need to look at those questions and answer them with total confidence. Let's do this.
All right, this is the stuff that can make your head spin. Who do you see first? What do you do now? You've got a bunch of patients, they all need something, and you have to pick one. The entire NCLEX is basically built to test your ability to make these critical decisions safely and quickly. So here's our game plan. First, we're going to break down what the NCLEX is really asking you. Then, we'll lay down the foundation with the number one most important rule, the ABCs. After that, we'll add some more advanced frameworks, put it all together into a step-by-step thinking process, and then wrap it all up with some golden principles you can take straight to the testing center. Okay, let's zoom out for a second. Every single one of these prioritization questions at its heart is a test of your clinical decision-making. It's not about memorizing a million facts. It's about knowing which fact matters most when everything is happening at once. And that's really the key, isn't it? The NCLEX wants to know if you can think like a safe, competent nurse when the pressure is on. So these frameworks we're talking about, they're not just test-taking tricks. They are the mental habits that great nurses use every single day on the job. All right, let's get into the most important part. If you remember absolutely nothing else from this, remember this, the ABCs. This is your non-negotiable starting point for everything. It's always the first place your brain should go. ABCs stands for airway, breathing, and circulation. It's a super simple acronym, but it's also a life-saving hierarchy. It tells you the exact order to think in. Because honestly, without a working airway, nothing else you do for that patient is going to matter one bit. And the priority here is crystal clear. You always start with A for airway. Is it open and clear? Is there any obstruction, choking, or that scary stridor sound? If the airway is good, you move to B for breathing. Is oxygen getting in? Is there O2 sat tanking? And only after you've cleared A and B do you move on to C for circulation, things like hemorrhage, shock, or chest pain. I really want this to sink in. If a patient's airway is threatened, nothing else matters. Seriously. That patient is your number one priority. End of story. Everything else has to wait. Okay, but what if you don't have a clear ABC problem? Or what if you have two patients who both have breathing issues? How do you break the tie? Well, that's when we need to pull out some more tools from our toolkit to help us refine our decisions. First up is a simplified version of Maslow's hierarchy of needs. For the NCLEX, it boils down to this. Physical needs always come before emotional or psychosocial needs. So a patient struggling for oxygen is a way higher priority than a patient who's feeling anxious. It's about immediate survival first. Next, let's talk about acute versus chronic. An acute problem is something that's happening right now. It's new, it's sudden. A chronic problem is something that's been going on for a while. The NCLEX will always want you to focus on the acute issue because that's the one that represents a sudden, dangerous change. And on that same note, we have stable versus unstable. An unstable patient is someone whose vitals are out of whack or changing fast. A stable patient might have a very serious condition, but for right now, it's under control. You've always got to go to the unstable patient first. And finally, there's expected versus unexpected. Is this finding something you would expect to see with this patient's diagnosis? For example, a little bit of pain after surgery is expected, but a sudden drop in blood pressure? That is completely unexpected, and it's a huge red flag that something is wrong. Okay, so we've got all of our individual tools, the ABCs, Maslow's, acute versus chronic, and all the rest. Now let's assemble them into one powerful, step-by-step thinking machine. This is how you're going to tackle every single one of these questions. So here it is. This is your mental checklist. For every single patient in the question, you run them down this list. You start at the top. Is there an airway problem? No? Okay. Is there a breathing problem? A circulation problem? If there are no immediate ABC issues, you move down the list. Is it acute, unstable, unexpected? The patient that flags the highest on this list, that's your priority. All right, let's put it to the test. Mini scenario number 1. You've got patient A having an anxiety attack and patient B with an oxygen saturation of 86%. Who are you running to first? Think about it for a second. Yep, it's patient B, no question. Why? Because an O2 sat of 86% is a clear B problem, breathing. That's a physiological, life-threatening issue. The anxiety attack is an emotional or psychosocial need. And our frameworks, both ABC's and Maslow's, tell us that breathing always comes first. See how that works? Okay, ready for another one? You have one patient with a long history of chronic hypertension. You have another patient who just developed a sudden, severe headache, and their blood pressure is also high. Who's the priority? It's the patient with the sudden headache, for sure. The patient with chronic hypertension is, well, chronic. It's their baseline. But that sudden, severe headache, that is acute. It's unexpected, and it makes that patient unstable. That could be a stroke, and it needs your attention right now. We have covered a ton of ground, so before we finish up, let's boil all of this down into the most important, bite-sized takeaways that you can easily remember when you're sitting in that exam. Here is your ultimate cheat sheet. This one little table captures the entire thought process. ABCs are king. Physical needs beat emotional needs. And you're always choosing the patient who is acute, unstable, or has unexpected findings. This is the core logic, right here. And to make it even easier, here are your 4 golden principles. You can almost chant these to yourself. Life-threatening first, new before old, unstable before stable, and physical before emotional. If you can burn those 4 phrases into your brain, you're going to be in fantastic shape. So there you have it. You now have the framework. The code has been cracked. The real question isn't whether you can answer these questions anymore. The question is, how are you going to intentionally use this step-by-step process on every single practice question you do from here on out? Go out there, practice with this new confidence, and you are going to do great.
Thanks for watching. If this video helped you think like a real registered nurse, subscribe and follow for more nursing content.